It's an unfortunate incident, and it was a long time ago. Just as a detective sergeant dealing with a tragedy that involved a child's death that could have been criminal. And that it's something I still think about today because you have kids, you have grandkids, and these things sneak up on you and still choke me up. I just remember looking back that I had to deal with that very professionally, looking at it as if a crime might have been committed and how we're going to handle that. And I just remember the effect that it had on the child's grandmother, who was absolutely distraught in the middle of the street. I remember the parents who were completely distraught and how very little we could do for them, if anything, to be quite honest, at the time. We were concentrated on what happened here and taking care of that. And when you think back on things like that, when you realize, okay, I might be doing my job as a police officer, but there's so much more that's needed there. And you need to find those resources and you have to reach out. And I understand that it's not realistic that I can train all my officers to deal with that, or that I don't have the resources that I can have somebody keep up with those people. Because quite honestly, as horrible as that incident is, you're moving on to another one almost immediately. Or you're handling 2 or 3 or 10 incidents like that as a detective, let's say. So marrying up with an organization that can help those people, because that's what all of us are here to do, is to help and serve people, is a great thing. And it always hits back to moments like that so much more is needed. And up until fairly recently, I didn't think that there was that opportunity. And now that we found it, that's why I tell other police departments, there's nothing to be afraid of here. This is a great thing. And this really does go along with our core mission of serving, of protecting, of helping people, everybody.
On this episode of TLC Connections, we sit down with Chief John Myrsiades of the Plymouth Township Police Department, a veteran officer with nearly 4 decades of experience who has seen the landscape of public safety change dramatically. In recent years, calls involving homelessness, mental illness, and substance use have surged, prompting departments like his to ask, what more can we do to meet the growing needs of our communities? In response, Chief Myrsiades helped launch a partnership with the Lincoln Center, embedding a licensed social worker directly within the department to co-respond alongside officers. This conversation explores how that shift is playing out on the ground, what's driving the rising demand, and why partnerships like these may represent the future of effective, compassionate policing. We hope you enjoy the episode.
Welcome to TLC Connections, the podcast where educators, counselors, coaches, and community leaders come together to inspire change, one connection at a time.
Welcome to TLC Connections, our podcast here at the Lincoln Center for Family and Youth. I'm Julie Knudsen, the Director of Development, and today we have Chief Myrsiades from Plymouth Township Police Department. I am so looking forward to this conversation because it's a topic that truly I'm so passionate and interested in. And what we're kind of going to focus on is co-responders and embedding a mental health professional into a police department. So welcome, Chief. Thank you so much for taking the time to meet this morning.
No, absolutely. Thanks for having me.
So if you just start off just telling me a little bit about yourself, your journey through law enforcement, your career with Plymouth Township Police Department, about 30 years.
Yeah, I've spent my whole career with Plymouth. I'm in my 37th year actually now. I went through the ranks. I've been the chief of police now for 6 years. And there's been a lot of challenges only because Plymouth Township has changed so much. And we've noticed since about 2019, maybe 2020, that we've had a lot more need for social services. We've noticed our homeless population in the last 5 years has increased. Well, the population, not so much, but our calls for service to the homeless have increased by over 500% in the last 5 years. And with that comes incidents of mental illness and substance abuse and then being victims or responsible for assaults and so forth. So we were looking for a different way to handle it, to help rather than just contain it or make an arrest or move on from one call to the other. And And we found that this co-responder program has been a blessing. It's been the answer to a lot of the concerns that we've had.
So definitely want to talk about that more specifically, but still leading up, I'm curious, like when you talk, what do you think some of the changes are in the community when you said around 2019? What have you seen as most significant?
I think, unfortunately, the issue of COVID changed a lot of things. I don't know if that caused a lot of displacement for people. I know that it caused a lot of anxiety for a lot of people. And then we started to see a lot of these changes. We saw a lot more incidents of attempted suicides, of substance abuse during that period. There was a lot of social change at that time also. And we noticed that with some of the laws that had changed, we saw an uptick that has increased in criminal activity. It's been difficult for everybody. And I think that those two things, the issues of COVID and the social changes, were largely responsible for some of the changes we saw in the township.
And how has your force grown? Has it been the same number of officers, or have you been able to hire?
For the longest time, we were the same number,
Yeah.
but with this change, our council's been very receptive, and we work with the council and the manager, and we have slowly increased to meet the needs of the community. And I think we're still in those kind of talks of increasing where needed to help with the congestion, to help with those that are in need.
Mm-hmm.
So that is something that we continue to do. So I'm very grateful because I'm lucky. I have a council that I can work with and that has the same concerns that I do.
Yeah. I would imagine. I'm a social worker. That's why I'm passionate about this model, embedding the mental health and social services and law enforcement. But mental health isn't new. Domestic violence isn't new. So I would imagine these are calls your officers have responded to throughout life. Child abuse, the same social issues. So again, is there a difference how you responded or how you were trained, or does that factor into leading towards a co-responder as well?
Well, we have changed the way we do things. I mean, I can think back to when I was an officer. There wasn't the training, or at least I wasn't made aware of the training. And we handled those calls the same as we would handle any others. And unfortunately, it was almost a dismissive way. Like, that's not an excuse for your behavior, or you answer with an arrest. And that's clearly not the way to handle these things. As time has gone on and more training has been made available, we've sent officers to learn not just de-escalation, but how to deal with whether someone's autistic, or whether someone has a mental illness, or whether they're suffering from depression or a substance abuse, to learn some of the root problems and better ways, not just to deal with people, but alternatives to arrest, because these situations don't really call for arrest. There's reasons for the behavior, and there's better ways to deal with that. And then as part of that, with the training, we've realized that there are other agencies that you can marry up with that are even better suited to handle that. They're educated in that field. That's strictly what they do. And I think a lot of people also are less threatened by dealing with someone who is not a police officer, maybe not an authority figure,
Mm-hmm.
and you have to respect that and not feel threatened by that. So when we've got into those types of relationships, we found that works even better, and we learn even more.
Yeah, and I can, we're just developing kind of our partnership and relationship. With that said, we're also, Lincoln Center, we have a Department of Justice grant, trauma-informed de-escalation, and you have all your officers going through it, so we started that. So I really appreciate that, and can tell in the short time your leadership of thinking outside the box, bringing things to the officers. So, you recognize that things were changing 2019, 2020, it's 2025. So can you kind of gap that to why now, and how you were kind of a pioneer? I know police departments are thinking about co-responders, but you took a jump.
I just think because we saw not only that this newer problem manifested itself, but that at least in our case, it continues to grow. I've looked at the municipalities and agencies that surround us, and I've noticed that a lot of them don't have the same issues. So we tried to find out why. I think one of the reasons is that we're more of a transient community. We have major arteries going through Plymouth. We have the largest, busiest state interchange in the state of Pennsylvania. We have 5 exits off the Blue Route. So we have hundreds of thousands of people coming through the township. Public transportation comes along with that. So access to Plymouth is easier for people. It's very commercial, so it has a lot to offer. It's not just big residential homes. There's a lot of businesses. So I think that attracts a lot of people. And it also attracts people in need. So you have to meet those same needs. So we saw that not only we realize this, I don't even want to say it's a problem, it's a challenge, but that it continues to grow. That maybe as more and more people realize that this area is a hub and maybe there are more services for them, that they start to congregate. We have a lot of hotels, and those hotels have gone from areas where people come and go to where groups of people have used those as an actual residence. And then, of course, our calls for service have increased to deal with that. So we're looking for ways to accommodate these people. I don't look at them as outsiders. They're not outsiders. Anybody in our jurisdiction is our responsibility. We serve those people. So this is a new segment, a group of people that have special needs, and we want to make sure that we can meet those needs.
That's terrific. And, I appreciate, frankly, our dual relationship, which is, having a Lincoln Center mental health professional staffed through us and working together. And, we were talking a little bit before we started recording about already the impact it sounds like you're seeing in 2 months and 8 weeks. If you can speak to that a little bit.
Absolutely. I mean, we've only had about a month and a half, I think, where we've had a social worker there. And in that month and a half, we've had over 150 follow-ups by the social worker. And that's on a part-time basis. I truly believe that with more time there, a lot more will get accomplished. And my lieutenants bring me reports to show me some of the things that the social worker has done, and it's things that hadn't even occurred to us, simple things. Where somebody just needs help getting up, someone who's elderly or has special needs that they've fallen and they need, and we help them. We ask them if they need anything. Usually they tell us that they're fine. But the fact that our social worker has followed up, she found that the person is shut in, is lonely, has medical needs, and she's married them up with resources, and they've been, eternally grateful. We've had some tragedies where the social worker has gotten involved. And the social worker has been a great resource for our officers. They've developed a terrific relationship with her, and she gets to know them, and they start to come to her with some of their issues. There's PTSD. There's private issues that they feel free to discuss with her. So it's been a terrific undertaking.
Yeah, I love that you made that last point. In the short term, I was fortunate enough to kind of gap it a little bit, but that benefit of the officer wellness and, to help with resiliency and retention, just kind of those informal conversations and that relationship building. So I don't know if people are, maybe my ignorance chiefs can appreciate what you do and recognize not only the benefit to the community, but to the officers as well.
No, absolutely. And there's maybe because I've been in this field so long, there's incidents that these officers go through where we'll tell them, that was a terrific job, great. And then I find out later on from some of their supervisors that some of the officers might still be struggling with some of the things that they saw or had to go through. And I hate to admit that some of that doesn't occur to me. I think you did great. Nobody got hurt. But you forget that you're dealing with younger people, you're dealing with a different generation, and it's good that they have these thoughts and they're thinking. We have very compassionate officers, and the other side of that is you start to feel, you internalize a lot of that. So knowing that and knowing that we have these resources is a great thing because it's needed, and there are others that recognize that need, which I certainly appreciate.
Yeah, and again, from the leadership top down that you recognize that, getting more involved in this work, law enforcement, the last couple of years, really, like life expectancy, is shorter, divorce rate higher. So, all the toll where people are like, I'm good. Are you really? Yeah.
Right.
Yeah.
You can't just take that at face value because there's always that image thing that you don't want anybody to think that you're weak or that you're having problems. you should be having. You should have some issues when you see some of the things you see. So it's almost like we try and mandate, like, I'll take that onus off of you. I'm going to send you to talk to somebody. I'm going to make sure that I have somebody on staff to talk with you, so that choice is taken out of your hand. That we're going to mandate it instead. So that's not something they have to worry about. You're not asking for help anymore. We're offering it regardless.
Yeah, but with the co-responder being different, much more informal. It is informal counseling, but we hire master's level clinicians in a way, but it's that supportive, collegial. I've found, in that role, sometimes you don't realize you're really opening up and talking about things you need to without being voluntold.
No, you don't. They routinely do it over a cup of coffee or just passing in the hallway. They've in this very short time, they've all developed a very easygoing, close relationship, which is terrific. That just speaks to the program.
Yeah. So what would you say to some departments that are apprehensive? Because I've talked to some, they're like, I don't, that are concerned about it.
Honestly, I don't know what the concern could possibly be. I've only seen positive. I don't see any negatives. I think that one of the things that I appreciate about the program is no one has come in and mandated, like, well, this is what you need to do, or this is, I see that A, B, and C you're doing wrong. It's been very easygoing. It's been a getting to know you situation. And every department's needs are different. I understand that. But I would say utilize this system to find out what your needs are and move forward with that. I think it's a relationship that takes a little bit of time to decide what works mutually for everybody. I really don't see a downside in any of this. This is all about helping people, and that's our business. So how is that a bad thing?
Yeah, I guess so. I wonder, people worry about safety of the co-responder, of it's such a different discipline. If someone told you 15 or 20 years ago about this model, hindsight's 2020, what do you think you would have thought?
I might have thought that it's dangerous to introduce a civilian into some of these situations, but we certainly take precautions. We don't have a social worker go anywhere on their own. I
think too much so, if I can say. Having been there where we're used to being in the field, but right.
Just because
I think that's a misnomer. They're not rushing out to calls with officers.
No, they're not. We either have them, we have referrals, they do follow-ups by phone. There are times where they need to or want to see the person, or the person wants to see them. They don't want to come to a police station, which we understand. We have an officer go there because you never know what might trigger somebody, whether it's PTSD, whether it's mental illness, whether it's substance abuse. For everybody's sake, I think it's safer to have someone there just to make sure that everything is okay. But we also give them their privacy and let them do what they feel they need to do. Again, it's just a situation where you have to gradually find what works best. But we haven't seen a downside. Again, I think the pros undoubtedly outweigh the negatives.
Yeah. Well, I think also, again, your leadership style in terms of letting this evolve, to not saying, here's the script for the program, like kind of here's the need, and the communication with your command staff, having worked closely with your co-responder now and been in that role is awesome. Letting it, like you said, community specific, and having done it for a little bit, what a resource for the township. It's almost like your own case manager to respond. Yeah.
We have a lot of people from the community calling, thanking us, saying that they've contacted their township and said, why don't we have something like this? Our council and our manager have been thrilled with the program. And we wouldn't want to put parameters on this. I mean, you all are the professionals in that field. We want to learn from you. You explain to us what you think is necessary, and then we'll just find ways to make that work in the system that we have. So, no, we're very grateful, and it's been nothing but positive.
So are there plans to expand or evolve the co-responder program?
I would like to. In the short time that we've had it already, I've seen the obvious benefits to it. One of the easiest enhancements to this would be to go full time. It's 3 days a week. And oftentimes in the days in between, we're asking where our social service worker is, and we could, use her today. And, she comes back, and then she's got a long list of things to follow up on. And again, this is in a short time, and seeing how many things she's following up on, you start to realize I had no idea that there were these many issues there. And just from where I'm coming from, you know, as I see the township as a whole, we're really trying to get into technology and we enhancing our drone program and there's a lot of things that we know we need to do because of a lot of the issues we have. But I never want to lose our core function, which is people and relationships. And I think that's one of the things that we do well. We deal with an area, I mean, Plymouth Township is one of the busier areas in Montgomery County. We have many arrests because of the commercial area we have. We're always looking for other ways to deal with people, to divert them from an arrest, especially when we're dealing with kids or when we're dealing with people that are unhoused and don't have the the funds or the ability to pay for something, and they're stealing food. I mean, it's cruel to deal with that strictly as an enforcement agency. So we're always looking for other ways, and this is a great way to do it. So as we grow and we look toward the future, I want to make sure that we remind ourselves that this isn't a transient community. This isn't just a place where hundreds of thousands of people come through. This is our town. This is our home. And that includes everybody that's there, whether you own a house or you don't, whether you've got a job or you don't, that you matter and that we work for you. We're here to serve you. And I think this is a great way to do it.
Yeah, I really appreciate that. We even adding on to the technology piece a little bit and kind of, again, our partnership, we have the resources. I know your co-responder is working on a very targeted resource list for your communities. We have county resources, but getting to the place of a name and a contact, and we hope to get that on a barcode. So when she responds or follows up on calls, we'll be able to also streamline referrals. So it just keeps growing. So at the Lincoln Center, we talk about the butterfly effect, and we say sometimes one moment, one choice, one connection at a time can be transformational. Can you think of a time, a person, a moment in your life that was transformational to put you kind of where you are?
I think, it's an unfortunate incident, and it was a long time ago. I mean, I've been doing this so long. I think it was in the mid-90s, just as a detective sergeant dealing with a tragedy that involved the child's death that could have been criminal. And that it's something I still think about today because you have kids, you have grandkids, and these things sneak up on you and still choke me up. I just remember looking back that I had to deal with that very professionally, looking at it as if a crime might have been committed and how we're going to handle that. And I just remember the effect that it had on the child's grandmother, who was absolutely distraught in the middle of the street. I remember the parents who were completely distraught and how very little we could do for them, if anything, to be quite honest, at the time. We were concentrated on what happened here and taking care of that. We might have called for a chaplain to help them, which was very minimal what they could do for them, waiting for a family member to show up. And when you think back on things like that, when you realize, okay, I might be doing my job as a police officer, but there's so much more that's needed there. And you need to find those resources and you have to reach out. And I understand that it's not realistic that I can train all my officers to deal with that, or that I don't have the resources that I can have somebody keep up with those people. Because quite honestly, as horrible as that incident is, you're moving on to another one almost immediately, or you're handling 2 or 3 or 10 incidents like that as a detective, let's say. So marrying up with an organization that can help those people, because that's what all of us are here to do, is to help and serve people, is a great thing. And it always hits back to moments like that so much more is needed. And up until fairly recently, I didn't think that there was that opportunity. And now that we found it, that's why I tell other police departments, there's nothing to be afraid of here. This is a great thing. And this really does go along with our core mission of serving, of protecting, of helping people, everybody.
Thank you so much for sharing that and putting it in context. It has been such a pleasure, truly. I thank you so much for taking the time and for going with this program and going with us, frankly. So I really appreciate it. Is there anything you'd like to share that I didn't ask?
No, I think we covered everything. We're also very grateful. I mean, I think this is terrific. You all have helped us probably a lot more so than we're assisting you. So it's changed a lot of what we do in a good way, and I'm actually hoping to enhance that as we go forward.
Thank you.
TLC Connections is supported in part by the Lincoln Center for Family and Youth. Through education, counseling, coaching, and consulting, we empower people to make positive choices, meaningful connections, and transformational change. To learn more, visit thelincolncenter.com.